Good afternoon, everyone, ladies and gentlemen. Welcome to yet another exciting edition of the Young and Dynamic. And I hope all of you are ready. My name is Charity Yepwe, and I will be your MC today. I just have a few rules that I will need to tell you. First of all, please do mute your mic so that you do not disturb the flow of the meeting. As well, please, if you're not really stable, please mute, also switch off your video so that you do not disturb the flow of the meeting as well. And yes, please have your notebook and your pen with you so that whatever is going to be taught today, you guys are ready and you're writing it all down. Once again, welcome to another exciting edition of the Young and Dynamic. Before we begin, I'd like to say a word of prayer. So yes, let's bow our heads and pray. Father God, in the name of Jesus, we thank you, God, for this meeting that we're about to start. We're praying, oh God, that you be with us, that you help us through that everything we're going to learn, God, we understand and apply it into our lives and we will be changed. In the name of Jesus Christ, I pray, amen. Guys, also use the chat box as well. That's another point. Please use the chat box. Say hi, my name is Charity. Say hi, Charity. Say hi to everyone who's here. Today we are going to have medical students from MSc. They're going to be talking on childhood cancer. Their names are Tinashe, Lorraine, and Kundirai. So I hope all of you guys are ready. I'm going to leave. I'm leaving this time to the team to play the video.
Okay, sure. Thank you. So, as been highlighted before, September is a month that has been dedicated to childhood cancer awareness. So, we as the medical students, we managed to go to Senga High School, a local high school in the neighborhood, and taught them about childhood cancer, just to make them aware of what's happening, because childhood cancer has been rampant and has been a major cause for concern. And we saw it fit that before September ends, we share something and we contribute something. Like as the medical students, we are the ones that are in the field, and there's need for us to take action. So we created the video of what transpired yesterday, and I'm going to share the video in a moment so that you get to have an appreciation of what I will be saying after seeing the video. So let me just share the video right away. Can you please confirm if you can see my screen?
Yes, we can. You can proceed.
Is it audible?
Yes.
Okay, so let me restart it again. Thank you. That was the video.
Right.
Interview.
Oh, thank you very much for playing this video. Just something before you guys continue with your presentation. I just wanted to tell everyone and let them know how lucky we are today to be having such an empowering and powerful session, because most of us, we do not really know about childhood cancer. Yes, we know that cancer exists, but it's really rare that we would hear that a child has been affected by cancer. So to have a whole month dedicated to childhood cancer, to be honest, this is like the first time. I think September is coming to an end, and yet this is the first time that I'm hearing about how it was childhood cancer awareness month. So now we are going to give you guys more time to tell us about what childhood cancer is and to really expand our minds and to enlighten us about this topic. So over to you guys.
Sure. Thank you. Let me share the slide right away so we can get right into it. Can you see my screen?
Yes, we can see your screen.
Okay. So we're going to take you through the slide that with the information that we taught the students at Senga High School, as well as the information that we told the parents that we met on our way to Senga. As you've seen in the video, that there was one of our students explaining to an old lady about childhood cancer. So there's a quote on the screen which says, "There's no footprint too small to leave an imprint on this world." And this statement resonated well with me, that even the smallest of the contributions can go a long way in curbing the effects of childhood cancer. And everyone should take part in this campaign so that we can deal with cancer once and for all. Then I'm going to talk about the prevalence of childhood cancers, and these are the statistics that we found on the internet that were published by WHO. And we managed to find out that globally, childhood cancer affects about approximately 400,000 children, with 80% of these cases occurring in the low and middle income countries. And as we all know that our country, Zimbabwe, fall within that spectrum. So it is part of the 80%, which means that there's something for us to do, like in terms of technological advancement, so that we can better deal with cancer, so that we can reduce that percentage. Moving on, childhood cancer incidence in sub-Saharan Africa is estimated at 56.3 cases per million children, with Kaposi sarcoma and lymphomas being among the most common cancers, particularly in children affected by HIV. So in sub-Saharan Africa, out of every million children that you come across, 56 of them have got childhood cancer. And coming closer home, in Zimbabwe, childhood cancer survival rates are alarmingly low, with less than 20% of the children surviving after diagnosis. And 20% is quite a lot, and there is need for us to reduce that percentage so that we save lives. Those young lives, they need to be preserved, because within them lie ideas that can revolutionize the world. Then in 2022, 67 children in Zimbabwe died from cancer, which include neuroblastoma, leukemia, and retinoblastoma. Then moving on. So like the numbers were just there for us to have an appreciation that cancer is a major cause for concern, and there's need for us to better understand it. And once we have understood it, we will know a better way of dealing with it, because making decisions from an informed perspective, those decisions are more bound to be sound, and that is the only better way we can deal with cancer. So what is cancer? So cancer is a disease where cells in the body grow uncontrollably. These abnormal cells can spread to other parts of the body. Cancer can happen almost anywhere in the body and comes in many different types. So like our body is about cells, right? And those cells, they proliferate at a certain point and they die at a certain point. So when there's a dysregulation in the proliferation and the apoptosis of cells, the apoptosis just means programmed cell death. There will be growth, and that growth can be benign or malignant. So when we say a growth is benign, it means that that growth cannot spread, but the cells just accumulate on one place. And that type of cancer is not life-threatening, except when it becomes large enough that it starts to obstruct like certain parts of the body. Like if it grows in what is called the mediastinum, it might compress the esophagus, leading to what is called dyspnea, which is hard swallowing. And malignant cells are those type of cancers that can spread to other parts of the body. And this is life-threatening, because when it spreads to other parts of the body, it can cause complications there. So that's basically what cancer is. Then what causes childhood cancers? Unlike cancers that happens in adults, childhood cancer is more aligned to the biological causes. That is to say, a child inherits the cancer from their parents, right? Unlike those that affect adults, they might be influenced by the lifestyle or the environment. So childhood cancers are caused by biological factors, meaning to say a child inherits a mutated gene from their parent. Right? Genes are instructions that instruct how proteins should be coded. So if a gene is mutated, right, it can cause the abnormal proliferation of cells, and this can lead to what I was saying, cancer, because abnormal proliferation of cells is cancer. So under environmental factors, the causes of childhood cancer are not completely understood, while adulthood cancers are usually linked to lifestyle or environmental factors. Cancer in children is different in several ways. A child can be born with an increased genetic risk for cancer. For some children, this happens by chance. For others, the risk is passed down from their parents. So cancer is a type of a germline mutation, and sometimes it can just happen randomly or by chance. So there's need for us to empathize with those people, because it's not by their choice that they've got cancer, but just by chance. This is another slide showing another common causes of cancer. Like I was saying, genetics are one of the major contributory factors towards childhood cancers. Some children are born with a change or mutation in the gene, like I was mentioning before, for example, a retinoblastoma gene. And this may be because they inherited the gene from one of their parents. And if they've got a mutation in the retinoblastoma gene, it leads to a cancer that is known as the cancer of the eyes. Then moving on, we've got medical conditions. Certain conditions can increase a child's risk of developing some types of cancers. For example, Down syndrome. Like those children that are born with Down syndrome, that extra chromosome that they have can make them more susceptible to getting cancer. That's why I was saying that it's by chance that someone can get cancer, and there's need for us to be there for them, because it's not their will that they've got that cancer. But there's need for us to offer psychological support. Then problems with development in the womb. Some childhood cancers begin when the baby is still inside their mother. For example, Wilms tumor. Wilms tumor is the cancer of the kidneys. Like we all know that a human being comes from a single cell, and those cells, they differentiate. So when they differentiate, it might happen that at a certain point, the cells might stop maturing. Then once the child has been born, they start to develop or mature at an uncontrollable rate, leading to cancer, and it is common in Wilms tumor. And as we shall see as I proceed, Wilms tumor can result in blood in the urine. Point number 4, exposure to infections. Infection with EBV can contribute to the development of cancers, for example, Hodgkin's lymphoma. So it is very important for pregnant mothers to be cognizant with their sexual behavior, because they can contract these viruses like the Epstein-Barr virus, which can lead to certain types of cancers. And they need to be very cognizant about their diet as well, because there are some of the foods that they eat that are carcinogenic. They need to carefully watch their lifestyle. They should avoid alcohol consumption and smoking. Then other causes of cancer are exposure to radiation. Cancer treatment for children can also include radiotherapy, which predisposes to another type of cancer. So radiotherapy uses ionizing radiation, and that ionizing radiation can go on and mutate the genes. And when it mutates the genes, for example, it might be a tumor suppressor gene, and when there's a dysregulation in the tumor suppressor gene, it means that the gene is no longer able to perform its suppressing function, so that the cells will begin. When it's the time for the cell to die, it doesn't die, because the gene that was responsible for that has been mutated. Then previous cancer treatment with chemotherapy can increase the risk of cancer, in such as acute leukemia. It works the same way as the exposure to radiation. Then this slide is just summarizing the most cancers affecting children. We have got the one that is most common is leukemia. Leukemia is the cancer of the blood. We know that our blood have got cells, and there can be abnormal proliferation of those cells, which is called leukemia, and it is the most common cancer. It is followed by brain cancers, which can lead to focal neurological signs that a child might find it very difficult to concentrate in class and to learn new things. Yeah, and when you notice those signs, it is very important to visit the medical personnel so that they can figure out what's wrong. It might be a childhood cancer. Then we've got the cancer of the eyes, the retinoblastoma. We've got Wilms tumor that I mentioned earlier that affects the kidneys. We have the neuroblastoma and the cancer of the muscles. So this slide is summarizing the incidence of childhood cancers, with leukemia contributing about 30%, central nervous system tumors or tumors of the brain contributing about 25%, then lymphomas 11%, soft tissue sarcomas 7%, and the other cancers that are not yet known. Meaning to say, we need to invest our time in research so that we can find out what makes up this 16%, because we cannot deal with something that we do not know. Then we've got common symptoms of childhood cancers. And as we are seeing here, there's headache. Like African parents have got a tendency of brushing away things. When a child comes to them complaining of a headache, they just tell them to drink water and go to sleep, and they'll be well the next day. And you never know. Whenever a child comes complaining about a headache, you should take them to the hospital so that the medical personnel will be able to find what it is. It might be a cancer. Then we've got lumps, bruisings, and upset stomach. Then there are what are called night sweats. We know that in Africa, yeah, it's quite hot, but sometimes the night sweats might be caused by cancers, not the temperature. So there's need for us to see which is which and closely monitor our children in their sleep. Both children are very vulnerable in the sense that they're not able to complain. What they can do is just cry. So there's need for us to carefully watch our children and be there for them whenever they present with these symptoms, and we need to take them seriously. Then we've got discharge from the nose, the squint. The squint can be because of the retinoblastoma that we saw, or that is the cancer of the eyes. Then there's also early puberty and stiffness. Stiffness can be caused by osteosarcoma. Osteosarcoma is the cancer of the bones, and there's a certain fluid that exists between the bones, known as synovial fluid. So cancer can lead to like friction in between the bones, and this can result in stiffness. Moving on, early detection and awareness. We should be aware that the earlier the cancer is diagnosed, the better chances of it being treated is that we can determine that someone is cancer at an early stage, so that there's a better way of treating that cancer. And education and awareness campaigns. Campaigns are aimed at educating parents, teachers, healthcare providers about the signs and symptoms of childhood cancer. Yeah, people need to be aware that this disease is real and is killing children, and they need to give it the seriousness it deserves. And campaigns like we did on Friday, they helped the parents, the teachers, the healthcare providers to be able to know like the common signs and symptoms. And the better someone is informed about something, the more bound they are to make good decisions. So education and awareness campaigns can lead to early detection and awareness. Then regular health checkups. People should make it part of their habit or their lifestyle to, even if they are not feeling anything, they should just go for a random checkup. You never know, because some of the cancers, like the cancer of the rectum, you cannot determine it. You cannot determine it, but it can only be diagnosed while it is reached in advanced stage. So it's only the regular checkups that can be able to detect that cancer at an early stage. So encouraging regular checkups with pediatricians who can monitor growth, development, and screen for potential health issues. Then we've got parental vigilance, educating parents on the common symptoms of childhood cancer, such as unusual alarms, persistent headaches, unexplained fevers, and fatigue. Yeah, parents and teachers are people who spend most of their time with the children, and they need to know these things so that when manifest, they will be able to know that it might be cancer and take the necessary procedures that need to be done so that we can save lives. Then screening and diagnostic tools, using complete blood counts and other tests to identify abnormalities. Yeah, there are like technologies that are being created now that can detect cancer at a very early stage, and this can be used for early detection of cancer. Then support groups. Yeah, we need to encourage our parents to partake in certain groups, be it WhatsApp groups, that can educate them on like what is happening in the world. It's not only about cancers, but a lot of things are happening in the world, and they need to be informed, right? So they need to partake in support groups, and from those support groups, those support groups, right? Community groups can even raise a pool of funds that they can dedicate to cancer research. So providing access to resources for parents and caregivers to connect with support groups and obtain information about childhood cancers. Then, yeah, we have known what cancer is. We have known how to detect it at an early stage. Now it's time that we talk about the treatment of childhood cancers. And cancer treatment includes surgery. Like I was saying that cancer is the abnormal proliferation of cells which can result in benign tumors. Like that, if a tumor reaches a certain stage, it might need to be removed, right? So in order for that to be removed, there's need for a surgery to be performed to like physically cut off that lump in order for one to be treated of cancer. Then there's need for chemotherapy. Chemotherapy is the use of chemicals that can be taken in form of tablets or in form of injections, and this can help in the suppression of the abnormal proliferation of cancerous cells. Then we've got radiation therapy. I think I mentioned it before. Radiotherapy makes use of the electromagnetic waves or the ionizing radiation that is targeted to a specific part of the body that is cancerous, so that it can also suppress the proliferation of cells. Then we've got immunotherapy. Immunotherapy, there are certain chemicals that are injected into a patient that can boost the T cells so that they can be able to detect the cancerous cells at an early stage, and they can be able to suppress those cells so that the cancer will not manifest. Then we've got the stem cell transplant. Stem cell transplant is the removal of all the cancerous cells and the replacement of those cells with the new cells. We should know that all our cells that we have, they come from the bone marrow. So and those cells from the bone marrow, they are able to differentiate into anything. So if we are able to replace all the cells that are in the bone marrow and replace them with the cells that are not cancerous, the better chances of us of treating cancer. And it is one of the ways in which we can deal with cancer once and for all. The other ways can only suppress, but this can deal with cancer once and for all. Then we've got challenges in the treatment of cancer. The first challenge being the financial burden. Like the families with children that are suffering from cancer might not be able to take their children to the medical personnel. And we know that the procedures that are done to treat cancer, they are very demanding, and they need someone who is financially stable to finance those procedures to be undertaken. So like financial burden is one of the ways in which is posing a challenge in the treatment of cancer. And it is also one of the factors that is contributing to research challenges, because for research to be conducted, there is need for resources to finance that research. So somehow it affects the level at which research is being conducted. Then we've got knowledge gaps. As I was saying, that people, they don't even know what cancer is. And if they do not know what cancer is, if someone has got a headache, they might think that it's just a headache and just pass. And if someone is passing urine with blood, they might think that it is bilharzia, which is common here in Africa. So there's the knowledge gaps are posing a challenge in the treatment of cancer. Then we've got healthcare systems and limitations. That is the medical personnel themselves. They do not even, some of them, they not even know what that cancer is, right? they might know, but they might know on the surface, right? So there's need for those medical personnel to invest the time in research and to know what really cancer is. It also goes a long way in bridging those knowledge gaps. Then we've got the psychological effects, like the people like that are suffering from cancer, and even the families of the people that are suffering from cancer, they're suffering from the psychological effects like depression, anxiety. Because sometimes the mother is just looking at their child suffering from cancer, and they don't even have anything to offer. You see, and it's not good for someone's mental health, and it can result in psychological effects. Then research challenges, I mentioned something about it. Then the cultural beliefs. Some people believe that in order for someone to be treated, they just need to stick to their faith, and there's no need, there's only need for divine intervention for someone to be treated. So they delay seeking medical attention up until the cancer reaches a certain stage where it becomes untreatable. So cultural beliefs are one of the challenges that are affecting the treatment of childhood cancers. Then these are the roles of the community to overcome the challenges, and we are the community, and we are the ones who are supposed to overcome the challenges that I was mentioning in the previous slide. And the first challenge was financial burden, right? In order to care for that financial burden, there is need for financial support and accessibility. And in Zimbabwe, there are boards like the Cancer Association of Zimbabwe that is responsible for raising funds that are channeled towards research, so that we can better understand what cancer is, and we can be able to deal with it in an informed perspective. Then the second challenge here was knowledge gaps, and we can conduct education and awareness campaigns like the ones that we conducted in order for people to be aware of what childhood cancer is. Then there's need for strengthening healthcare systems. There's need for pediatricians to go into clinics, hospitals, and educate like the nurses, the medical personnel, so that they can also understand what really cancer is, because cancer is becoming a major cause for concern, and there's need for us to do something. But in order for us to do something, we must be informed. Then psychological support, like I was saying, that the people suffering from cancer, they are suffer from anxiety, they suffer from depression, and it's not their will that they've got cancer. So there's need for us to offer psychological support, like to empathize with them, to be in their shoes, so that it might help them in dealing, it might help them mentally. Then there's a need for us to invest in research and development, so that we might understand what really childhood cancers are, and how better to solve them. Then we've got community support groups, like people can create WhatsApp groups where they can discuss what childhood cancers are, and they can also contribute funds that can be channeled towards the research of childhood cancers and how to deal with them. Then there are common misconceptions about childhood cancer. The first one being survivors are disease carriers and pose a health risk to others. So cancer is different from influenza. If you get in contact with someone that is with influenza, you're more bound to get influenza, but it's a different scenario altogether. For cancer, childhood cancer is not transmitted by a virus, no, is it infectious? So we should not shy away from people that have got cancers, because by mingling with them doesn't guarantee that we get those cancers. And I mentioned that the causes are genetic factors, and they need to be passed from one parent to another. The second one being all survivors are genetically inferior and they've got fertility problems. that is not the case. You might find out that people with cancers are one of the people that might be very brilliant maybe in terms of school. So having a disease doesn't mean that you're genetically inferior. So the type of cancer and treatment determines the fertility challenges. So it is like the type of cancer that we have that determines the fertility challenges. Then survivors have got short lives. Then the fact is that 2 out of 3 child cancer survivors have risk to secondary cancers, but this isn't linked to life expectancy. So life expectancy isn't linked to childhood cancers. Someone might even grow to become a fully fledged adult, though they had cancer in their childhood. Survivors do poorly in school and employment. That's a myth. The fact is that most survivors perform very well in their education and career. Then the hope and progress. Right, these are the things that are being done in order for us to deal with cancer in a better way, to detect cancer at an early stage, and to deal with cancer in such a way that it doesn't affect someone's life, so that someone might be able to live a normal life even though they've got cancer. So we've got immunotherapy. The drugs, like those that I mentioned, are part of the class of immunotherapies that block certain proteins, allowing the immune system to attack cancer cells more effectively. Then we've got targeted therapies. By analyzing the genetic mutations driving a patient-specific cancer, doctors can tailor treatments to target those mutations. So there are certain technologies that are being developed that are known as CRISPR technologies that are able to target certain parts of the gene that are cancerous and remove those genes and replace that gene in a process known as gene editing with an appropriate gene that is not cancerous. So yeah, it is one of the ways that is being used to treat genetic factors, genetic diseases, of which cancer is one of the genetic diseases. And it's our hope that cancer can be treatable in the future. Then advances in early detection, you've got lipid biopsies, new blood tests are emerging that can detect cancer at a very early stage by identifying tumor DNA circulating in the bloodstream. Then we've got improved surgical techniques, robotic surgery, laparoscopy techniques. Have reduced recovery times, post-surgical complications, while also enabling more precise removal of tumors, minimally invasive surgeries. So we see that technology is paving way for the treatment of cancer, in the sense that they are incorporating the use of advanced technology like robot surgery that can minimize that can make the procedures less invasive. Then the last point being being the global initiatives and collaborative research. It focuses on increasing access to treatment, training healthcare workers, ensuring that children in low and middle income countries receive timely and effective care. And this is one of the goals of WHO, so that it's investing a lot of resources in training healthcare workers and helping low to middle income countries to invest their time in research, to equip them with the resources to conduct research. Because I believe that in Africa, there are a lot of brilliant minds, but they are not equipped with the resources that they can use to fight against these cancers or to invest their time in research. And I think this brings us to the end of our presentation, and hopefully you've managed to get something from our presentation. And thank you.
Wow, wow, wow. What powerful words from our medical students, guys, from the MSU. Did you guys hear the jargon, the big words that they were using? I was really inspired. So everyone with questions, this is your time to shine. Send in your questions in the chat box. If you wish to speak, raise your hand. The team will be going through and will allow you to speak. Personally, I was really inspired. I don't even want to lie to you guys. This is the first time ever in my life that I'm hearing about childhood cancer. So this was very enlightening to me. At least now I have knowledge. I'm no longer ignorant. I can also like participate in this fight against childhood cancer. So thank you very much for this opportunity that you've given us to learn about childhood cancer. And guys, please do send in your questions. Personally, what I liked from their presentation is that they spoke about problems, right? Problems that the the people are facing, the people who are actively trying to fight against this childhood cancer are facing. And in my mind, I was thinking, okay, what about the solutions? And then on the next slide, they had solutions. So this only shows how we're not only focusing on the problems, but they also suggested solutions to us on how to battle this problem of childhood cancer. So they also mentioned about how we as the community are the ones who are supposed to take initiative in this fight against cancer. You don't expect the next person to do it, or because they're smart, or because you think that they're like this or that. Every single person in the community has a role to play in this fight against childhood cancer. So everyone with questions, please type them in the chat and we are going through. Okay, so we have one question here in the chat from Miss Otilia Chidaenzi. She says, how is childhood cancer diagnosed? So this goes back to you guys. How is childhood cancer diagnosed?
Okay, thank you for that question. Childhood cancer is diagnosed like when there is an abnormal proliferation of cells in the gene. Like a doctor can physically see that there's a dysregulation, like in the genes of the patient. They can I'm forgetting the appropriate term, but can check for they can check for the human genome to find a section of the human genome that is mutated, right? And this is being done by technologies such as this called what? Prenatal, I'm forgetting, but it is even able to be determined that a child has got cancer from their mother's womb. And once that cancer has been diagnosed, it can be treated by various ways that we mentioned.
Okay, thank you very much for that. We have another question from Tulo Hudo. He's asking, in what ways can I actively help in the fight against childhood cancer?
Okay, thank you for that contribution, for that question. You can offer psychological support. Like we know that people that have got cancer are depressed and got anxiety. So you can go to them and make one-to-one personal interactions with them and offer psychological support. And I believe that can go a long way in keeping their like dealing with their mental health issues. Then you can also contribute like funding in terms of there's a lot of research ongoing, right? So you can invest, you can contribute to a pool of funding that is being set aside for cancer research. That is one of the ways us as young children can contribute to the caring of cancer. Thank you.
All right, thank you very much for that answer. Before we move on to other questions, I also have my question as a follow-up to what you just said. So in terms of psychological support, just like you guys did yesterday, you reached out to people, right, in schools and adults, and you were talking about childhood cancer. Let's say someone has childhood cancer or someone has cancer and I'm trying to approach them. How do you suggest I do that in a way that is not like offensive to them, as if I'm stigmatizing them, or I'm trying to isolate them. So how would you suggest that I approach them?
Okay, thank you. You know that at a later stage of cancer, someone might lose their hair, right? So one of the better ways of approaching someone with a cancer patient is for you to remove your hair, so that you put yourself in their shoes. They feel like you're with them. You're able to empathize with them. Like you really understand what they are going through. Like I believe that is one of the ways in which you can approach cancer patients without stigmatizing them.
Wow. Wow. So yeah, the hair issue, but it's okay. No problem. We also have another question. Someone is asking, is there a minimum age for childhood cancer, or it can affect children of like every age?
Cancer can affect everyone, but when we are talking about childhood cancer, it's most prevalent from the ages 0 to 19. So from the ages 0 to 5, that's when cancer is most prevalent because of the children. They cannot talk about the symptoms because they do not know, but it can affect from 0 to 19. Because in teenage or puberty, they can talk about the symptoms like urine with blood and the like. So childhood cancer is from 0 to 19 years.
Okay, thank you very much for that answer. And then we also have someone else who is asking if there are any indigenous knowledge systems regarding cancer. Like, can it only be treated in the hospital, or are there some herbs or whatever we can use in order to treat cancer?
That is beyond the scope of our research, but we strongly encourage people that if they suspect that they have cancer, they seek medical attention, because like the medical personnel have got the better ways of treating that cancer. Because the moment people delay, right, the cancer can reach a certain stage where it becomes very complicated to treat it. So if people suspect that they have cancer, we strongly encourage them to visit the hospitals, seek medical attention. Thank you.
All right, thank you very much. Someone in the chat says that I think there are indigenous ways to deal with it. I think that you can also like send in the chat so that everyone else also like sees, so that we also benefit from the knowledge that you have. So someone else is asking, how can cancer pain be managed?
Okay, thank you for that question. So in the medical field, there are some things that are known as anesthetics, right? Uh, the anesthetics, they block certain nerves that send afferent fibers to the central nervous system that causes pain. Do you even know that there are certain sections of the body that are not sensitive to pain, right? So, like by delivering in anesthetic, the afferent fibers can not reach the central nervous system. It's more or less like we've blocked a channel of pain in the brain, so that you cannot feel pain. Because pain is more or less like a defensive mechanism, that if you feel pain, you tend to move away from that thing. Like if you touch a hot plate, you remove your hand from that hot plate. So pain is a defensive mechanism which can be obliterated by using anesthetics. Thank you. Are there any more questions?
I think our MC might have dropped. Sorry. There's one last question here. Someone says, I don't know whether this question has already been asked. I would like to know how best can I advise someone who thinks maybe being affected by cancer is the end of their life?
Okay, thank you. The previous slide, we talked about the technologies that are coming up that are improving the diagnosis of cancer. And it is being diagnosed early. There are now better ways of suppressing that cancer, like targeted therapies, where a section of the gene that is cancerous can be removed, so that a person can be treated completely of cancer. And I also talked about the stem cell transplant, that those cancerous cells can be removed, and new cells that are not cancerous can be injected into the patient. So there's hope that cancer can be dealt with once and for all, and there's hope that in the future cancer can be treatable. So to someone who's going through who's suffering from cancer, it's not the end of their life. We strongly encourage them to adhere to their treatment, because one day, I believe, cancer will be treatable.
All right. Thank you very much for these wonderful answers. Thank you also to everyone who asked a question. I'm not sure if there's anyone who has another question, but if not, then thank you guys, our future doctors, for coming onto this platform to enlighten us about childhood cancer. I'm honestly inspired by you guys. So we have come to the end of this session. Please make sure that you go onto our YouTube page, because this is broadcasted on YouTube. So if you know anyone who didn't manage to attend the session today, please reach out to them and tell them that this session will be on YouTube as soon as right now it's actually live on YouTube. So if they didn't manage, still they can still go after the session and still watch this session. So to everyone who came onto this platform, thank you very much for coming. I hope you also got some nuggets on childhood cancer, and I hope that this is not the end, that we are going to go into our communities and spread the word about childhood cancer, and also look for ways that we can contribute in order to end or fight this childhood cancer. So this is it from me. My name is Sarah. I was your host for today, and see you next Saturday. Bye.